So hello friends, so in this video I am going to discuss you about the flow of aqueous fluid, and also that is the normal physiological process of aqueous fluid, and third that is definition of glaucoma or what happens in glaucoma, and number 4 that is about the treatment of glaucoma. So please stay tuned and watch till that. So now I am going to discuss you about the flow of aqueous fluid. But before knowing the flow of aqueous fluid, you should know what are the parts of the eye. So friends, see this diagram. By seeing this diagram, so you can relate what are the parts of the eye, and the parts of the eye are sclera, choroid, retina, optic nerve, optic disc, vitreous body, lens, cornea, iris, pupil, and aqueous chamber. All these, and also ciliary body, and all these are the parts of the eye. Now I am going to discuss what are the parts forming the posterior chamber of the eye. So friends, please see this diagram. So by seeing this diagram, so you can relate that the retina, posterior portion of sclera, optic disc, optic nerve, macula, they together form the posterior chambers of the eye, and cornea, lens, iris, ciliary body, pupil, and also entire portion of sclera. So all these parts they together form the anterior chamber of the eye. So posterior chamber of the eye and the anterior chamber of the eye. So now I think you have been understood. So now you can easily understood the flow of aqueous fluid. So now aqueous fluid, so here flows from posterior chamber of eye to anterior chamber of the eye. Now from anterior chamber of the eye, that is aqueous fluid, so here that is exits or leaves the eye by coming out from drainage canal of eye, and this drainage canal of eye always remains open, and from this drainage canal of eye, then this aqueous fluid comes out and exits the eye and goes in the systemic circulation. So this whole is the, so here that is describes the flow of aqueous fluid. So see about the flow of aqueous fluid that I have written there. So here that is aqueous fluid. So here that is comes from posterior chamber of eye, and from posterior chamber of eye it goes into the anterior chamber of eye. Then from anterior chamber of eye it goes into the drainage canal of eye. Then through this drainage canal of eye that it exits the eye and goes into the blood circulation. So this is the pathway of the aqueous fluid in the eye and how it enters the systemic blood circulation. I'm going to explain about the normal physiological process of the aqueous fluid. But before knowing this normal physiological process of aqueous fluid, you should know that is what is the angle of the eye. So friends, please see this diagram. So by seeing this diagram, so you can relate that here is an angle present between the iris of the eye and the cornea of the eye. Yes, and that angle which is present between the cornea and the iris of the eye is known as angle of the eye. And the normal range of this angle of eye is 5 to 22 degree. So this is all the normal. So now, so I am going to discuss about a normal physiological process of aqueous fluid. So since this angle of eye always remains in a physiological range of 5 to 22 degree in a normal person, so due to this, that is the drainage canal of eye that is always remains open, and this angle of eye also does not become narrow nor widen, so the drainage canal always remains open. So the aqueous fluid can easily that is exit the eye through this drainage canal and can go into the, so here systemic blood circulation. And due to this, that is in a normal person, that is in the aqueous humor, that is excess amount of aqueous fluid, so here does not accumulate in the aqueous humor because that is drainage canal always remains open. And since the excess amount of aqueous fluid does not accumulate within the aqueous chamber, so therefore that is the intraocular tension or the intraocular pressure of the eye also remains within a normal range, so therefore that is no disease occurs. So this is a normal physiological process. See about the angle of eye or open angle of eye, the definition I written, that is the angle between the iris and the cornea. So this is known as angle of eye or the open angle of eye. So see the normal situation, that is a drainage canal of eye that is always remains open all the time, and the excess aqueous fluid does not accumulate within the eye. Why? Because the open angle or the angle of the eye also remains within the normal range, and the normal range of angle of the eye is 5 to 22 degree. And since this, so here that is drainage canal of eye always remains open, and this excess aqueous fluid also does not accumulate, and also that due to this region, that is the intraocular tension or the intraocular pressure within the eye also remains within the normal range. So this is the, so here that is the part or the description about the normal physiological process of the aqueous fluid within the eye. I'm going to discuss what happens in glaucoma or the definition of glaucoma. So friends, now see these two diagrams. So the left sided diagram is a normal physiological diagram, and the right sided diagram is a pathological diagram. So you can notice that in this pathological condition, the angle of the eye is narrowed first, and also I can see this diagram. So by seeing this diagram, so you can relate that as compared to normal process, that in this pathological condition, that is the drainage canal of eye is blocked. Now what happens is that in this pathological condition, due to the blockage of this drainage canal of eye, that this aqueous fluid, so here that is can't exit the eye because the drainage canal of eye is blocked. So as a result, that is aqueous fluid, so here that is accumulates within the aqueous humor of the eye, and due to this excess accumulation of aqueous humor within the due to this excess accumulation of aqueous fluid within the aqueous humor of the eye, that is intraocular tension or intraocular pressure rises inside the eye, and then this leads to a pathological condition known as glaucoma. So simply that in glaucoma, that is the angle of the eye is narrowed, and second, that is the drainage canal of eye is blocked, and due to blockage of this drainage canal of eye, so here that is excess aqueous fluid accumulates within the aqueous humor. So as a result, intraocular tension rises, and this leads to a pathological condition known as glaucoma. For a definition of glaucoma I have written there. See, that is a pathological condition when the angle of the eye becomes narrowed and the drainage canal of eye is blocked. Now, as a result, that is the aqueous fluid, so here that is accumulates within the eye, that is excess aqueous fluid that is accumulates within the eye. Excess aqueous fluid accumulates within the eye, so therefore, and this increases the intraocular tension within the eye, and due to this, there is a pathological condition occurs, and that pathological condition is known as glaucoma. So simply that is in glaucoma, that is the angle of the eye becomes narrow and the drainage canal of eye becomes blocked, and due to this excess aqueous fluid accumulate within the eye, and as a result, that is the intraocular tension or the intraocular pressure within the eye increases, and this leads to a pathological condition known as glaucoma. That's all. So now I'm going to discuss here about the treatment of glaucoma. And now you should know that for treatment of glaucoma, that is a drug known as pilocarpine is used. And now I'm going to discuss that is how these drugs, so here pilocarpine, so here used for the treatment. So first of all, that is the main basic point you should know, that this pilocarpine causes contraction of ciliary muscles. Now, due to contraction of the ciliary muscles of eye, that is the angle of the eye that is being narrow in glaucoma, so here it increases. So the contraction of the eye muscle, that is the ciliary muscle of eye, that is angle of the eye increases, and due to the increase in the angle of the eye, that is a drainage canal of eye also opens, and due to the opening of this drainage canal of eye, that is called the excess aqueous fluid which is accumulated within the aqueous humor, so here that is goes out from or exits through this drainage canal, and as a result intraocular tension decreases, and then so here that is the glaucoma is treated. So once again, that is this pilocarpine causes contraction of ciliary muscle. Second, due to contraction of the ciliary muscle, angle of the eye increases. And third, drainage canal of eye also opens. So as a result, that is the excess aqueous fluid accumulated within the aqueous humor. So here that is exit through the drainage canal of eye. So as a result, that is intraocular tension or pressure also decreases and glaucoma is treated. Now see about the treatment of glaucoma what I have written. So that for treatment of glaucoma, that is pilocarpine drug is used. And what is the action of this pilocarpine drug? That is pilocarpine drug, so here causes contraction of ciliary muscles of eye. Now due to this contraction of ciliary muscles of eye, that is glaucoma is treated, and I am going to tell you how. See there, a contraction of ciliary muscles of eye. So due to this contraction of ciliary muscles of eye, that is the angle of eye increases, and due to increase in the angle of eye, that is drainage canal of eye increases, or that is drainage canal of eye gets open. So that is the automatic, the fluid pathway for aqueous fluid also gets open, and due to this, that is excess accumulation of aqueous fluid does not occur within the eye or within the aqueous humor. So as a result, that is the intraocular tension, so here that is decreases. So therefore that is glaucoma is treated. So that is a contraction of ciliary muscles. So due to this contraction, angle of eye that is increases. So therefore that is a drainage canal of eye. So here that is does increase, it opens. So due to this also that is a fluid pathway for aqueous fluid also opens, and this excess accumulation of aqueous fluid does not occur. IOT that is decreases, and glaucoma is also created. So this is the main concept, that is how that is pilocarpine. So here that is causes treatment of that is glaucoma, that is main is a contraction of ciliary muscles of eye.